I am Maria Victoria Mateos, hematologist and director of the myeloma unit at the University Hospital of Salamanca in Spain. Another abstract also related with this GEM-CESAR study is the evaluation of a new technique in order to evaluate the M component. QIP-MS spectrometry has been evaluated in patients included in the GEM-CESAR study, and we collected samples after induction, transplant, and consolidation. The results are quite comparable with SPEP immunofixation and next generation flow, but there are important messages. The first one is definitely mass spectrometry is more sensitive in the evaluation of the M component than the conventional SPEP and immunofixation techniques, and this means that with this technique we are going to optimize the timing at which we have to evaluate the minimal residual disease in the bone marrow. We also evaluated the concordance between mass spectrometry and next generation flow in the determination of minimal residual disease, and the concordance is quite high. Of course, we need a longer follow-up in order to evaluate how mass spectrometry and next generation flow can potentially detect early relapses, and in line with this we can potentially early intervene monitoring mass spectrometry instead of next generation flow in the bone marrow, what is much more convenient for the patient because mass spec is done in the peripheral blood. Another important abstract that will be presented during this Congress is an update of the ALCYONE study. ALCYONE study is a phase 3 randomized trial conducted in elderly patients with newly diagnosed myeloma, in which VMP is compared with DARA plus VMP. This is the third update we do for this study, and when we compared the results of this update study analysis in comparison with the primary analysis, the benefit in terms of overall response rate, CR rate, minimal residual disease negative rate, and progression-free survival is sustained. But the most important data is the benefit we have already observed in terms of overall survival. The median follow-up is 40 months, and when we add DARA to VMP, we reduced the risk of death by 40%. Toxicity profile is acceptable. In fact, we had the opportunity to evaluate minimal residual disease negative as well as sustain the minimal residual disease negative at 1 year, and definitely this is going to be an excellent surrogate marker predicting both progression-free survival and overall survival. These results clearly support the use of DARA in the upfront setting in this study in combination with bortezomib, melphalan, and prednisone in the elderly population.